Let's talk about vasculitis. Vasculitis is the destructive inflammation involving the vessel wall. We have revised Chappel Hill consensus classification. Actually, there is destructive inflammation which is involving the vessel wall. In the revised Chappel Hill consensus classification, we have predominantly large vessel, medium vessel, as well as predominantly small vessel vasculitis. So predominantly large vessel vasculitis. Here large vessel means aorta and its branches. The examples are Takayasu arteritis, and we have temporal arteritis, which is also called as giant cell arteritis. Now we have predominantly medium vessel vasculitis. The medium sized vessels are like renal arteries, mesenteric arteries, and coronary arteries. The examples are like polyarteritis nodosa, Kawasaki disease. And we have predominantly small vessel vasculitis. The example of it's like arteriole, capillaries, venules, and veins. And under this small vessel vasculitis, we have ANCA vasculitis and also immune complex mediated vasculitis. ANCA vasculitis are like GPA, that is granulomatosis with polyangiitis, EGPA, eosinophilic granulomatosis with polyangiitis, and we have MPA, that is microscopic polyangiitis. And the examples of immune complex mediated vasculitis are like anti-glomerular basement membrane disease, or it could be IgA vasculitis, which is also called as HSP, that is Henoch Colon purpura. We have cryoglobulinemic vasculitis, and HUV, that is hypocomplementemic urticarial vasculitis. So earlier, the granulomatosis with polyangiitis was termed as Wagner's granulomatosis. Now you can see in India there is a famous car called as Wagner, and from it we have this name. We can remember like this. And EGPA, that is eosinophilic granulomatosis with polyangiitis, like Church disease, like the car is going to the church. So we have another major heading like variable vessel vasculitis. Examples are BHS disease and Cogan's syndrome. Now we have single organ vasculitis, like which is primarily involving the central nervous system, called as primary CNS vasculitis. We have cutaneous arteritis. We have isolated aortitis, and CLA, that is cutaneous leukocytoclastic angiitis, which is also called as hypersensitivity vasculitis. And we have secondary vasculitis, which are associated with some systemic diseases like SLE vasculitis, rheumatoid vasculitis, sarcoid vasculitis, or IgG4 mediated disease associated vasculitis. We have vasculitis associated with some infections like hepatitis B, hepatitis C, and some associated with some other cancers. So once again revise, we have predominantly large vessel vasculitis under this Chappel Hill classification, predominantly medium vessel vasculitis, predominantly small vessel vasculitis. Small vessel means actually arterioles, capillaries, venules, veins. And underneath this we have ANCA vasculitis, or immune complex mediated vasculitis. And we have variable vessel vasculitis like patient's Cogan. We have single organ vasculitis involving primarily the CNS or maybe the isolated aorta, or could be cutaneous arteritis. We have secondary vasculitis, and we have vasculitis associated with some infections like hepatitis B, C, and cancer. Thank you.